Welcome back to Cheche. We're live on Citizen TV. Now, Article 43 of the Constitution guarantees the right to the highest attainable standard of health, which includes the right to healthcare services, including reproductive healthcare. But health is a devolved function, and county governments are responsible for the delivery of healthcare. Governors say they cannot afford to pay nurses more, as agreed in the collective bargaining agreement, which striking nurses want signed and registered. While today's guests have different perspectives, as we've been hearing on this issue, the governor of Nandi County, Stephen Sang, who's persuaded nurses in his county to return to work. He did that last week. Senator Moses Kajwang of Homa Bay, where nurses are still on strike and have been sacked. And Halima Aden, the secretary of the Machakos branch of the Kenya National Union of Nurses, which is divided with a faction loyal to Mr. Panyanko, the General Secretary, and wants the strike to continue, and another faction loyal to the chairman of the union, John B., which would like to return to work. Now, the question we've asked our viewers is how the strike is affecting them. So here's some of their feedback. Halima is right, there are no oxygen facilities in Nandi County. Sang Awache PR. These guys should give Halima space to talk. Nurses will never go back to work without a CBA, full stop. These nurses are jokers. I don't expect someone of her sort to lack some tangible evidence of why they went on strike. They're not Kenyan. They're supposed to go back to where they came from, Kenyan for Kenyan. I think that's a rather xenophobic message. I probably shouldn't have read that out. I would wish to ask the governor, I'm not sure if this is for you though, but maybe, you know, the council, your fellow governors, why would you want the unskilled to work? And let him know that nurses in Nandi are devastated because the promotions are to be approved by the CPSB, the County Public Service Board. Nursing is a profession. They need to be taken care of so they deliver quality services. If they're demoralized, they can't deliver. Let the SRC, COG and national government agree and pay nurses. They are the backbone of hospitals. That's Sophie from Kisi. Hello, I've seen the executive holding State House meetings with political leaders for political gains, conversations with doctors, they brokered a deal. The presidency holds very important meetings and is key to brokering deals. He should not say that we are county employees because he is the father of the nation. And finally, medical personnel should be classified as essential services and should not be allowed to go on strike just like the military and police. These guys are crying foul when they're all earning from the private clinics. They are not sincere. That comes from Hussein. So you see very mixed feelings. On the whole, though, it seems that the public sympathy, at least from the text messages, I haven't gone on to social media yet, public sympathy seems to be with the nurses. And so, Halima, you were talking to us about the issue of trust before the break. And you had made the point that you don't trust the government. And the governor had asked you, which government?
The employers. We have county levels of government. We have county governments and national government. No one is interested to sort the problem, because if they were interested, when the doctors were on strike, we saw, of course, we said the timing was wrong and all that, but it's the government that pushed us to that timing. So we saw very many people trying to have a solution to the strike. But with the nurses' strike, everybody seems to be hands off. Everyone is blaming the other and just asking us to go back on duty. How do we just go back on duty when we are talking of a collective bargaining agreement that was supposed to be done in 2013, just immediately after devolution?
Madam, is it the case that the reason why your strike has been sustained for all that period of time is because of something you call lockup, where nurses who are not working, when you are not in government hospitals, you go to work in private clinics and private hospitals.
Nurses don't even have time to locum. Unfortunately, nurses don't even have time to look up. We work in shifts. We're supposed to work in shifts. The last time these governors employed, I can't even remember, except for my governor in Machakos County, who employed 800 nurses, and I applaud him for that. But nurses, the shortage in the nursing profession is just too much. Nurses cannot get time to go and look
up. What I'm saying is that this time when you're on strike, you're not at home.
We are at home. You
are working somewhere.
No, we are at home.
But
eventually we'll find a way of surviving. God provides. God provides. People will not stop our salaries and starve us for us to go back and lose focus on what we want. Yeah.
Now that is the epitome of humanity, believing that God provides. So why don't you people, for the sake of Kenyans, go back to work?
Why don't you people, for the sake of Kenyans, Just provide the 5% we are asking for, and then we will go back.
Would work. I mean, we need to be fair to the nurses, because they work, they are professionals, and they've got legitimate concerns that they put in. Appealing to their personal morality is out of order in this particular matter. When the nurses say that there could be a 5% that is outstanding, let us remember Pareto's principle, that sometimes 20% could be more significant than the 80%. So the 5% that is outstanding is clearly critical, because if it was just 5%, they would have gone back to work. We need to ask ourselves, and I sympathize with the governors, because where they are coming from, and where my governor was coming from by sacking workers, which I don't support, and which I think is a discussion we must have with him so that he can rescind it, because such directives in the past have proven ineffective. They've got this problem of a huge wage bill. But this wage bill, we know its history. Amalgamation of local authorities, duplication of tasks. Governor Sang has already started doing a human resource audit. That is the way to deal with it. If there are redundancies, get rid of the redundancies. Are there redundancies in the health sector? I don't think there would be redundancies in the health sector. If you are going to remain with a huge wage bill, let it go to people who are actually delivering value rather than people who are just lazing about. We must deal with it from that perspective. If governors are able to deal with the redundancies and the duplication at their level, they can be able to release some money that can go to the nurses. But at the same time, they are still free to lobby the Senate so that when they're doing the division of revenue bill, we can allocate them more resources. In as much as there's...
Well, the Senate, in its wisdom, could make a provision for that.
Yes, we have done it. We have done that in the past. In the past, we have made provisions to the county governments, and sometimes we've had very long disputes with the National Assembly when we are proactively allocating funds to the counties. We must support Kenyans. It is not just about supporting nurses, because nurses provide a service to Kenyans, and the most underprivileged Kenyans at the bottom of the pyramid. The laws and the constitutions we have really are not to protect the rich and powerful. We are in a position, Governor Sang and I are in a position maybe to send our children to rehab in South Africa. But there is someone, there is someone there in the village who, if the local hospital is not open, they are dead. And I can tell you, the reason why I wear this badge, it is a reminder of the HIV status in Homa Bay and a reminder of the HIV status in this country. One of the things we must deal with is prevention of mother-to-child transmission. And if mothers are going to give birth at home without skilled attendants being present, then we'll still have more children being born with HIV and AIDS and being subjected to a life of uncertainty. We must think of Kenyans rather than just thinking about these nurses. So when these nurses go back to work, then Kenyans will have their rights as spelled out in the Constitution delivered.
So you make an important point before
Senator, as the body entrusted with ensuring the success of devolution, should Senate take the blame for the health situation in the country at the moment?
Well, we cannot run away from it. I cannot say that our hands are clean. We cannot run away from it. But our responsibility lies in making sure that there are laws. Our responsibility lies in making sure that there are resources to support the governors to deliver health care and to deliver basic services at the counties. We have tried our best. I don't think we are where we should be. I personally believe that the minimum 15% that is allocated to counties should be raised by constitutional amendment. I know the national government and through Senate and National Assembly, we've been providing slightly more than the 15%. But costing of health function, as the same case as costing of roads and costing of devolved functions that have been sent to the counties, it is not adequate. So yes, we take a blame because we need to up the resources allocated to the counties, but we also need to have a clear legislative framework which we have put in place. The President assented to the health bill on 21st of June. What I am not sure about is whether it has been gazetted. And we've seen such games with things like the PBO Act, where there's a requirement for gazettement and the government drags its feet such that a very good law with good intentions then does not come into force when it is expected.
You mentioned something important about birth attendants, and the people who have been disproportionately affected by this strike are expectant women and newborns. And so I come to, and one of our viewers actually says, you know, there's no concern about voters' health, but there is concern about voters. And that's an indictment of you, the politician.
Yeah, how come, the question is, how come that this strike of nurses strike was nowhere near the campaign? Nobody talked about them. So
and nobody is talking about it now.
Talking about it now. We are talking about other issues.
26th.
And the 26th.
More for.
How come?
Woodwork. Two things to respond. One is that for us to be able to approach the Senate for more allocation, we have to be certain of what we need. And that is the conclusion of the CBA. For us to understand the financial implications.
And what's stopping you from gaining that understanding?
The SRC has to play a part, and the Council of Governors and the national government.
But now
that is what is in the discussion table right now.
That certainly is true, but you seem to be flipping responsibility, because the SRC has said ensure that you have the monies, and you're saying the SRC has to come in.
What I'm telling you is that is not the position. You will appreciate that even for us, when we were in the National Assembly and the Senate, we had certain demands, you know, in terms of facilitating, for example, a senator. And the issue was not that we had inadequate resources. The problem was that SRC had not approved certain, you know, the resources to facilitate certain offices. So the question is not really about availability of resources. The SRC has to look at the entire wage bill of a county. When you get into an agreement with the doctors, the nurses came in. When we are discussing with the nurses and getting towards resolution, the clinical officers came in. As we started to negotiate with the clinical officers, the laboratory technologists, the radiographers are coming in. So really the point is that we have to have a holistic discussion about all these cadres. Because if you sign one agreement with the other one, you look at the financial implications and you think that you can squeeze in a number of things to accommodate that. And the moment you are just about to sign that, you have another cadre coming in. So really, what we would expect from SRC and the entire health sector is that let us have negotiations involving all these groups, so that when you have a final agreement, you know what financial implication it has. Otherwise, what we are likely, I can tell you, my budget in Nandi County is about 5.2 billion, but the amount going to the health sector is about 1.4 billion. So already that is almost a third of the entire budget, the county budget. If you have to implement all these increments across all the cadres, you are likely to have that at half the budget. Really, this is not workable for us.
But Governor, don't you need a healthy society?
Respond to this.
Sorry?
Don't you need a healthy county?
Absolutely.
You do.
But of course you also need them to feed them. You also need good roads for them. You also need them to, to go to school. So really, at the end of the day, we have to strike this balance. And I think the nurses, the clinical officers, and everybody within the sector, let us have an amicable discussion and be reasonable.
One of our viewers thinks you can't have a reasonable discussion because governors have governor families have medical covers and are attended to in private hospital. Why should they care?
I think that is one of the issues. Personally, when I took over office in Nandi County, one of the things that I made, and I know it might appear as if, this is not going to work, but I said all our county employees must first be treated within our health, public health facilities in our county, including myself. I was there 2 weeks ago, took some blood tests on 1, 2, 3 issues, and because as long as we have leaders and county officials, a CEC, an MCA, having the facility to go to Nairobi Hospital or to go to private, big private hospitals, and then we will not invest in our own public facilities. That is the direction that we need to go. And we have seen Magufuli in Tanzania, his family being treated within public facilities, and I think it is possible if we invest our resources in the right place, ensure that our public facilities are working. That should be able to address that issue. And finally, by the way, if we improve the facilities, our public facilities, that means some of these resources that come from National Hospital Insurance Fund will be able to find their way into our facilities. Somebody mentioned that we do not have enough oxygen equipments in our county. That is fine. In my facilities, that is fine. We do not have a few wheelchairs. That is true. We must be able to invest in this. And one of the better ways of doing it is ensuring that the facilities are working. We have patients coming to our public facilities. We are able to charge them. You generate revenue and plow back that revenue into improving these facilities. If we do that, that is the direction to go. But my plea to the nurses is that we know that we have that history of the previous regime. Give the new team an opportunity to work things out. I am coming in and finding a budget that has already been that was already approved in the last government. Even to accommodate the promotions that I gave to my nurses and the clinical officers and a number of the facilities within our facilities and get the equipment, I have to raid into certain budget lines to create resources for this. But there can be a limit to this. If we had this 1 year for us to organize ourselves, in the next financial year we should be able to cater and provide a framework for us to cover all these financial commitments that will arise from the CBA.
I hope the Council of Governors will put you on the negotiating team to resolve this strike. But Mutegi, I interrupted you. You're going to ask a question.
The issue I raised with her about them working. Isn't it true that nurses who are on strike are working now?
No, they are not working. How do we work? And we are always on the streets protesting. When do we work? They are not few. We are having protests all over. You want to see 26,000 for you to add? You want to see 26,000 on the streets? They will come.
I know many nurses who are working.
But more fundamentally, Mutegi, if you go to private facilities, how much do they pay the nurses? They are paid 15,000, 10,000. In our own public facilities, how much? It will shock you when you look at the pay slip of a nurse.
And have you checked how much they are paid in South Africa, in Namibia, in Nigeria?
We are talking about Kenya.
No.
We are talking about
you
Kenya.
also supposed to compare with best practices.
The point
you don't pay us peanuts because private hospitals are paying
peanuts. Someone tweeted here that other countries outside are looking for trained and registered nurses.
If those options were available, you wouldn't find a nurse in a private facility earning 15,000. Why are these ones in private facilities?
Now, let me respond to what he said about them negotiating with nurses and they're almost brokering a deal. It's a lie. We were not almost brokering a deal because every time we tried to do that, they came out and denied everything we had talked about. The other cadres are coming in because of SRC. SRC downgraded all diploma holders, health workers, nurses, clinical officers to unskilled grades. The same level as a gardener, as a watchman, as a driver. How much does it take for you to train a nurse in terms of time and money?
And that's
for SRC to come and downgrade the same
on that particular one.
One thing is clear here from what Governor Sang is saying. They feel the nurses. They would want to act if SRC would give them an opportunity.
I think now we'll focus to the Senate and Parliament because even today our protests will go and camp at Parliament for them to listen to us and probably provide funds for the governors. But I'm sure even if that fund is provided, they are going to divert it to other things.
More importantly,
because if the thinking of governors is what Governor Sang is thinking, with all due respect, that nurses in private hospitals are paid 15,000 shillings. In private hospitals, they don't employ nurses, by the way. They employ nurse aides. Those people who are being paid 15,000 shillings are nurse aides. And there is a difference between a nurse aide and a professional nurse.
What is the difference?
A nurse aide just takes care of the basic things. They train for 6 months.
Like a first aid or something?
Yeah, like feeding the patient, cleaning the patient.
And what do nurses do?
The nurses take care of patients holistically.
You have degrees.
Degrees, we have diplomas. The lowest is a certificate, which is being phased out this year.
And diplomas are being downgraded to unskilled labor.
Unskilled labor.
Okay. We don't know. The SRC tends to be penny wise and pound foolish. The clinical officers are on strike because of the manner in which they've been evaluated. The nurses are on strike partially because of the issues of their evaluation. And doctors also had similar issues. Even lecturers. Everyone seems to have a problem with the SRC. Now, sometimes public officers say that when everyone has a problem with you, you're doing your job. That is not the attitude to leadership, and that is not the attitude that public officers should have, that people should hate you. That's when you feel like you're doing your job. You're supposed to facilitate. I've just illustrated that if 25,000 nurses, their productive output is 1,000 per day, for the number of days they've been on strike, it's 3 billion Kenya shillings. We are not counting the lost lives. We are not counting the reduced productivity, because the people who work in the farms are at the bottom of the pyramid and they need treatment from hospitals. What are nurses asking for? They started with 25,000 in terms of allowances. She tells me they've climbed down a little bit. I'm a bit surprised that the Council of Governors has still not illustrated what this will cost them. I think we need to stop this brinkmanship. The COG is a body that is established by an act of parliament. It has power, and in the last 1.5 years, we have seen how capable they are in asserting themselves, especially where they feel their duties as enshrined in the 4th schedule of the Constitution is being infringed upon. This is an opportunity, Governor Sang, because when you're in the Senate, you are a very articulate and a very strong defender of devolution, where governors must say that the Constitution gives to them the function of provision of health, and the national government remains with policy and national and referral hospitals. We must ask, why must the national government allocate itself 60 billion Kenya shillings every year if primary health provision has been devolved? 60 billion shillings, that is enough to finance 10 counties. Governor Sang probably gets 5 billion or 6 billion shillings a year. Why must we still continue holding 60 billion Kenya shillings at the center? Can't this money then be devolved to the counties so that the counties are able to pay their nurses and doctors in a better manner?
It sounds like if we had the three of you, hold on. It sounds as if we had the three of you negotiating this CBA, it would have been done and dusted. Because you're speaking reasonably and you're articulating where you're coming from, but you also seem to appreciate each other's viewpoints. How then can we fix this? Because as you're saying, Halima, Kenyans are suffering. They're telling us. One person says that within the span of a week, they've lost 5 people.
Children are not getting immunizations. This will come back later. Children are getting HIV because mothers are delivering at home and they're not getting their ARVs.
We're losing people to cholera.
I think we need to set a day and meet with honesty. Sit down, talk, all of us, Senate, Parliament, governors, the union. The union is ready. Even if we are asked to wake up at midnight to come sit down and get a solution, we are always ready. Otherwise, threats will not work.
And you realize clearly, Udwak, from the representation here, you've said the 3 of them. That is the Council of Governors, that is the nurses who are aggrieved, and this is the Senate. So what we are missing here is the SRC.
Absolutely. Yes.
And SRC, by the SRC, we've had informal engagements with SRC. SRC said, provided the governors are able, the government is able to provide evidence that they pay.
And what they haven't done is cost it.
Moses Kajwang knows the SRC very well. Forget about engaging them.
Just try today. Write to them and tell them you have money to fund the CBA for Nandi County. They will give you the letter of objection.
Stop talking over each other.
We have communications directly from SRC having particular issues with the provisions. One of them, that I can flag it off immediately, is that the nurses are asking for 50,000 shillings for uniform yearly. And what the SRC has said, which again on this particular one we agree, is that why not provide uniform? We provide uniform for the doctors, their aprons and everything, but the nurses want it in cash.
Want the money.
And SRC have said that is not possible.
Nasalima, you want 50,000 shillings for uniform?
Wait, can I just give the history about the uniform allowance? And I think Governor Sang is a bit, he has not had what has happened about the uniform allowance. The uniform allowance was provided for nurses through the Public Service Commission, through a market survey that was done in 2008, where it was to be paid 50,000 then. And we have circulars.
2008.
Yes, 10 years. Yes. Ago. So if we do the market survey now, probably it will be 150,000, because I'm sure this suit you're wearing is very expensive. It's not even 50,000.
Let's talk about the issues and not personalities and where we show.
So the uniform allowance, SRC has already written after receiving a circular from Public Service Commission about the uniform allowance, and they said whatever we'll agree with the employer, who are the governors, they don't have a problem. They don't have an objection. So they have
And
already withdrawn. They have withdrawn.
Why can't you tax the uniform?
Yes,
and
that's the point you're making, that you can provide the uniform.
Just like we are providing
for doctors.
uniform for
Why is that
many other
objectionable?
cadres. Why?
Which cadre are they providing uniform for?
No, the laboratory technologists, everybody. We provide
There is
uniform
no one
across
who is
board.
being provided for uniform except the police. And with the police,
So
you give an
Okay, so
uniform
we
and
can
you
hear,
return after
we can
you exit
ask
the
our
service.
viewers to let us know how their uniforms are provided. We have to take a
But I
break
would need
now.
to get this
No,
clearly.
hold
You
on.
want 50,000 shillings for uniforms per year?
Yes, per year.
Okay,
Per
let's
year.
take a break. This is Cheche. We're live on Citizen TV. Please send your questions and opinions about the nurses' strike for our guests, and tell us how the strike is affecting you. Our SMS number is 22422, and you can reach us on Twitter using the hashtag Cheche.